made
There we
it.
are.
Okay, we are definitely live
God
now.
bless.
So, all right,
I will watch
everybody.
the chat for comments too in case we get any questions or anything.
Yes, thank you. So, we just had quite an ordeal trying to get this live going. I apologize for the delay. But we have Laura here. We also have my colleague Ashley, who's on the Bloom team. She's amazing. Both of these ladies are amazing when it comes to hormones, weight, inflammation, gut health, all the things. And so I'm really excited for the three of us. Of course, Laura's going to lead the conversation and the presentation on peptides, but I'm so excited to have these particular ladies on this conversation because all three of us are very much of the mindset that we can't do shortcuts with health. We want long-term results. We want safe solutions, and we prioritize people's health and longevity over anything else. And so I just love the integrity that these two ladies bring to the table. And I'm very excited to talk about this topic because it seems like everybody is talking about peptides. And I want everyone that is in my, community to understand like the pros and cons, what it can do, what the limitations are, because with anything new and exciting, I feel like there's a lot of hype around the conversation. And so I think it's really important to talk to and listen to people who are grounded in the science, grounded in the research, and have a more balanced approach to things. And so, with all of that said, I do want to hand it over to Laura. She really specializes in this area of health. And so I'm going to let her share her screen. Let's make sure she can do that. I think I might need to give you permission, Laura. So go
Okay,
ahead and try to share, and then I should be able to approve.
let's see.
All right. Looks like I can see your screen. So,
Yeah, you can. Okay, great.
yes.
Perfect. Then we'll just start it up. Let's see if I can switch this view here, guys. Now I need Ashley for all of her professional. Here we go, display.
Listen,
You are looking for the
there we
wrong
go.
person. There we go.
Okay.
All right. Hi, welcome everybody. Thank you so much for having me, Rebecca and Ashley. I really appreciate it. I just want to go through a little bit of who I am before we jump into all the peptide stuff. My name is Laura Young. I'm 40 years old. I live in Michigan, the cold state. Currently pretty good right now, but it's usually very cold. I'm married. I have three kids. I'm an FDNP. I really love cutting edge functional lab testing. My traditional background is in mathematics. I have a bachelor's degree in mathematics and health education. I actually was a high school teacher for many years before I kind of transitioned into this line of work. I'm also a published author. That's my book right there in the corner, just shameless plug right there. My book is called Trial and Mostly Error, which is pretty much how I fumbled my way through life up until now. And I'm a health and wellness advocate and coach. I love exercising and cooking. Those are my hobbies. I also love diving into scientific research, and I have a special place in my heart for peptides. And that's what we're going to talk about today. So let's talk a little bit about what are peptides. So they are biological compounds that are amino acids. So what are amino acids? Those are our building blocks of protein in our body. They're very small molecules. And if we think about them, they are kind of these amino acids that are linked together by peptide bonds. Our bodies naturally produce over 7,000 peptides. So these are already in our bodies that our bodies use for normal bodily functions and regulation. They are naturally occurring, or they could be made in a lab synthetically, like some of the peptides that we see now on the market. Okay. But they mimic what peptides do. So if we look at amino acids, these are the building blocks of proteins. Like I said, a peptide bond is just simple. And it's almost like if you think about a necklace and you have them strung along the necklace. And a protein is just a very complex compilation of peptides. Okay. So peptides, amino acids make up peptides, peptides make up proteins. That's a really simple way of thinking about this. So how do they work? They bind to a cell's receptor and trigger a cascade of actions. Okay. So if we think about a cell and there's like parking spaces on that cell, or some people say it's like a lock and a key, each peptide is a key that fits into a specific lock, and it either activates things or it blocks things from happening. That's endogenously what it's going to do. So like I said, this cascade of actions that happens, this cellular cascade, it's kind of like if you tipped over a bucket and all of these things were going to happen in response. So you're going to be kind of hard pressed to find a peptide that just does one thing. They actually do a lot of things in our body, and they can make these processes kind of kick off and have this cascade effect. And these are some of the frequently asked questions I get a lot. Are peptides hormones? They are and they aren't. So, hormones are chemical messengers, and peptides are kind of like hormones are almost like the umbrella, and peptides are underneath that umbrella because they are doing some signaling. But they are not technically hormones, like if you were talking about our sex hormones or something like that. They're not that. Um, are they a drug or are they natural? Like I said, there are 7,000 endogenous peptides in our body, and I'm sure there's more that we haven't found yet. But they can be made synthetically in a lab and reproduced to then be put back into our bodies. But they are natural. They do not cause cancer. So this is actually another myth we can debunk here. They actually are implicated in helping with some cancer treatments for specific peptides. So no. Um, what are some side effects? And these are some things like we hear on the news, like especially with the GLPs that we're going to talk about, like gastroparesis or digestive discomfort or stuff like that we hear about the GLP ones. They those can most of the time be very transient. What I mean by that is like short-lived. Sometimes these are happening more when there's a high dose, which we're going to talk about, not necessarily like small doses, or when they're used effectively, then we're not really getting those side effects. Actually, peptides have very little side effects in general. But there are some scare tactics that are out there on the market, and some things that have been published that I think, which we'll talk about, aren't necessarily the truth about some of the peptides, or there are people that aren't using them appropriately. And some people say, do I have to use them forever? And that, I guess, is up to the user, because I feel like if your thyroid isn't functioning properly, would you stop your thyroid medication? And if you're not, if your body isn't making something that it should be making, would you stop your insulin? Like if you were a diabetic? Probably not. So if something's working for you and it's the benefit outweighs the risk, then I would say sure, you can use them for as long as necessary.
So I have just a couple things I
Yeah.
would want to add because I know this is really, really big questions and big concerns. And I have, I'll share with you, Laura. I don't know if I've been able to share this with you before, but what's funny for myself is that when I first learned about peptides and it was like really hyped up, and at least that was the impression I got. I was like, okay, everybody, calm down. It's probably not this magic pill, which it isn't. We'll talk about that. But I did have some concerns and I did kind of get like mixed into like the all the huge like gut gastroparesis like heck no, like as FDNs we're really like some of our core pieces of health is thinking about our gut health, and
Right.
so I was like, oh no, if it's messing with the gut health, that's never a good thing, yada yada. And I just really dismissed peptides early on. And now, like that, I've learned more, I've taken more time to dig into the research and listen to some really, really incredible doctors on this topic where I already knew their character and their like standards for care. And so they started talking about peptides, and I was like, wait a minute, I trust these people. Why are they talking about
Mhm.
GLP-1s like it's a
Yeah.
good thing? And then they started explaining all the science. I'm like, oh, okay, this makes so much more sense. And what I've learned is to view peptides as similar to hormone therapy. Not that they are hormones because they're not direct sources of a hormone, but they can help to stimulate kind of, okay, here's a like a similar situation. Like for us, if we see that a woman is struggling to ovulate and produce progesterone, you could give her straight progesterone, or we could support her brain ovary communication and signaling to promote and gently encourage those ovaries to produce progesterone. There's certain herbs that can support that signaling, right?
Mhm.
So to me, it's like peptides are another tool in the toolbox that helps to gently signal our body to focus on um, stimulating certain benefits in the body. And so it's very different from just directly taking progesterone, if that makes sense.
Yeah, I get what
Um,
you're saying. Yeah.
yeah. And the other thing is like when they, like one of these questions is, do they cause cancer? Um, One of the things that I think is really important for us to keep in mind is that so many things in our environment, supplements and foods and smoking and pesticides, like all these different things, they're all creating signals, right? Technically, like when you're exposed to something, they're all going to have impact on your body. So the cool thing about the peptides is that essentially it's another way of signaling to the body like anti-aging and youthful benefits versus all these things that are inflammatory in our environment, increasing signals and in cascades of things that are not helpful. This is like one more tool to kind of shift in the right direction.
Right.
And so like while they don't cause cancer, they might encourage blood flow or they might encourage like cell repair and things like that. And so I think there's just been a lot of, like you said, some really sketchy research that was pushed out early on,
Mhm.
and now they've backtracked later on, saying kind of backtracking what they said about thyroid cancer, but the damage was already done. The rumor already started about like thyroid cancer. It's a big deal. Well, it's never been shown in humans. It's only been shown in like rats and mice,
Yeah.
and they have different receptor cells,
Mhm.
receptor sites than humans do, like
Right.
way more. So it's apples and oranges. It's not appropriate for to just jump to that conclusion. And they've literally, oh, and the other thing about that, you mentioned dosing and stuff and how they'll go super high. That study was like 60 times the dose on those rats compared to what they would give a human. It's like, well, of course that's not healthy. Like imagine giving 60 times the amount of anything.
Mhm.
Like that's not
Yeah.
a good idea. It's gonna
Mhm.
have some harm. So same thing with the gastroparesis. Like there's a lot of ways to use this tool safely and smart. And the same thing goes with HRT when people are using hormone therapy. They are always asking me like, is this safe? And I always say, it depends on how you're using this tool. If you are going at high doses or you're not doing a balanced approach or you're using synthetic hormones like progestins instead of bioidentical, to me, peptides are like bioidentical peptides that we can supplement our body with, especially as we age and levels start to naturally decline. That's kind of just some of my thoughts on these
Yeah.
FAQs. I just wanted to add in my perspective because I know a lot of my group would want to know like what my thoughts are on it and what I've seen and learned. And so hopefully that kind of gives you guys an idea of what my perspective is on these really important questions. Like I welcome these type of questions. I think they're important. I had those same questions. So I'm really glad that you covered these for sure.
Yeah. And that just goes right into proper use. So, like you had
Yes.
said, they are not a magic bullet. They work the best when people are hormonally optimized. So, when you have things kind of dialed in, like we talk about in FDN. So, when you have your diet and your rest and your exercise and your stress reduction kind of dialed in, and you said it's a tool in the toolbox, which is correct. I almost think of it as a condiment, not the main course. And I want to look at this in two ways because I think that the peptides can be a variety of different types of peptides, not just the GLPs, can be used in a variety of settings to do some things. So let's start with the first person, the person who's hormonally optimized and wants to take it to the next level, or they're having their really last bit of like weight to lose, or they can't really put their finger on this and that and the other thing. Those people can really benefit from a very small dose for a short amount of time and get some really good benefits, and it's going to work quickly, and it's going to just put the cherry on top, like I was saying. Then we have a different subset of people, because I also believe this wholeheartedly. If I have somebody that's 400 pounds and I need to give them a medication that's going to get the first 200 pounds off so that they can see some they can see some benefit, and they can see some weight loss, and then their body stops hurting a little bit and they start getting motivation because they're seeing some things happen, and then they're like, oh, I do want to get up and move. So I think it can be both. I think it can be the last bit of the cherry on top. It also can be the precursor motivation to get people into diet, rest, exercise, stress reduction. So I think it's all very personalized, and they both have been shown to be useful. It just depends on the person that's using them and what kind of counseling they're getting when they're using them.
Can
So
I
the
add
five,
something there real
yeah, for
quick?
sure.
So I had this conversation with actually a family member because she was very, very hesitant to use like a GLP-1, but she was at the point where like her weight was causing health issues. And so it was it was worth the risk for sure, like any risk that there could be. It was definitely worth the risk versus the reward because she, like, her weight was literally had put her in the hospital, because it was causing so many issues. And so it was like, hey, if we can get that weight
If we
off
can get the weight
quickly,
off, we can do
yes,
other things.
your
Yes.
body's gonna be healthier and you're gonna respond to all these other
Hmm.
things better. So in this situation, I think it's totally worth it
Yep.
because your weight is causing you issues and you're not able to lose weight because of your weight because you can't move
Yep.
properly.
Can't move properly.
You can't go to
Correct.
the gym and work out well because
Yes.
the weight is such an issue. And so that was a huge game changer for her was getting that
Yep.
help because it got the weight off a lot quicker. And then she was way more motivated to
Yes.
continue and get up and move and do all the things. So I love that you're saying that.
Thank you. And then these are the top five that we're going to talk about today because my niche is really midlife use, like midlife women and what every midlife woman should know for some optimal peptides. There is a lot of peptides out there, and honestly, they all kind of sound like, um, I don't know, foreign substances with all of their acronyms and 157 and 234 and whatever their numbers and everything. So they can be a little confusing, but the first subset obviously is a really popular GLPs. These are drugs that are called tirzepatide. One of them is called retatrutide, which I'm going to talk about today. BPC 157 and TB 500 are more for inflammation, joint tissue healing, post-injury, stuff like that. GHK-Cu, which is tissue regeneration. It has more properties than just that, but that's kind of the beauty peptide, I guess. Growth hormone secretagogues is a category as well. Two of them, Tesamorelin, Semorelin, there's other ones. And then PT 141 for sexual desire, arousal, support. So these are just kind of the midlife bucket that I think could be beneficial. So the first one, what I want to talk about first is the midlife shift, okay? Because this is what I focus on in my practice. And that's pretty much what happens as we age. So like you said, Rebecca, peptides decline as we age, okay? So these are going to just the 7,000 I told you that are in your body, they do decline as we age. Also, the midlife shift, we have reduction in insulin sensitivity, okay? This is perimenopause at its prime. Our visceral fat, this is from studies, you guys, these are straight facts, go from visceral fat, which is the fat around your organs, goes from 5 to 8% to 15 to 22% without any difference in your diet and exercise routine. This is just how things are distributing in your body because of hormone shifts. Our inflammation increases. We have more rapid weight loss, muscle loss. The newest onset of autoimmune diagnoses are in these 40s and 50s, this midlife area. We also have an increase in bad cholesterol and a decrease in good cholesterol. By the age of 60, our thymus gland, which is our immune gland, kind of sits in the middle of our chest here, which outputs T cells, declines 90%. So people who are of age, they're not responding well to infections or vaccines. So these things, because our thymus gland is aging, and that's our immune system. Okay, so these are some things that are happening that could promote some use of these. So the first two, tirzepatide and retatrutide. Okay, I made this chart just to get a kind of a visual. Tirzepatide we had GLP-1s, which is semaglutide. Then we had the dual agonist, tirzepatide, that works on two hormones, GLP-1 and GIP. Okay. And then the newest one, I kind of wanted to bring this because this is the newest one. It's in phase 3 clinical trials. I think it's going to be on the market in 2026. It is also developed by Eli Lilly, which is who developed tirzepatide, but it's a triple agonist. It has GLP-1, GIP, and glucagon. Okay. How are these things working? They are enhancing our secretion of insulin from the pancreas, but they're also making the cells more sensitive to insulin. It also is going to slow down your gastric motility and reduce appetite. Okay. So we've had really good clinical trials on these in people because obviously tirzepatide is a FDA approved medication. It was originally approved for obesity, but it has since been approved for sleep apnea as well and diabetes. Okay. So that is approved on the market medication. It's a once per week injection. And the dosing of these is very important and is very different across the board. Okay. So just because they are a GLP, like semaglutide is very different in dosing than tirzepatide, which is very different in dosing to retatrutide. So you have to really partner with someone who knows what they're doing. There's been more incidents of body fat reduction in the retatrutide studies, and it also has really reduced fatty liver. So a lot of people have non-alcoholic fatty liver, and it has in a trial the liver fat reduction was over 80%. Like I want to say in that study over 95% of the people that had non-alcoholic fatty liver just by using this retatrutide, no more, zero, like normal levels. So it completely could be a game changer in people with metabolic disorders.
And I will just add a little bit of perspective because I think, the regular layperson may not realize how big of a deal that is.
Yeah.
I was in a functional medicine seminar a few years back. This might have been like 5 or 6 years ago, and one of the top medical doctors that's on the Thorne research team, he was discussing non-alcoholic fatty liver and how it's this epidemic and how there's no pharmaceutical like solution
Right.
and all like this huge, they were seeing that this huge wave of NAFLD was upcoming because here's the real problem. And you're starting, I think, more and more data is starting to circulate in the media about pre-diabetes rates, like in children,
Oh,
in
it's nuts.
teens, in adults. Like I want to say 80% of Americans are overweight or like pre-diabetic. Like we're talking about the vast majority of people. And now young people, as young as like their teens, I think
Yeah.
it's 1 in 3 teens are pre-diabetic. What this means is it's a whole cascade of inflammation, hormone issues, infertility, like not just weight. We're talking your health from a metabolic standpoint up. And so almost everything in your health is affected by that. If you've ever known a diabetic person, you see firsthand all of the health impacts that it has on their eyes, on their limbs, on their immune system
Oh,
being
yeah.
able to fight infections. It goes on and on and on. And think about your liver and how your liver is involved in hundreds of processes. It really helps you handle all the toxins in our environment. And so when somebody has fatty liver, they have all these fat deposits in their liver's congested, their liver's not able to function well. It leads to a plethora of health issues. And so years ago, not that long ago, Dr. Roundtree was talking about this issue and like us in the health space needing to be the solution. We need to focus on this problem because there's going to be a wave of people who won't be able to get a liver transplant because the number of people with this problem is so big that there won't be enough people to get transplants and people will pass away from this. And so now to hear, fast forward few years later, that there's solutions in the works that are pretty as close to natural as we can get, right? To solving this issue is like honestly a huge deal and
Oh,
very,
yeah.
very
It's going to help a ton of
exciting.
people. Yeah.
It's life-saving. So I'm very excited about where peptides are going for sure.
This is just a little bit more on that breakthrough study. I linked to the study because it was just published in 2025 and I just posted on my Instagram about it yesterday. But the findings in the study, which I also really loved, they use DEXA scans. So if you don't know what a DEXA scan is, it's a bone density scan. It also tells you your muscle distribution and where like there are bones in your body. So It's not, this one was awesome because at 36 weeks, participants that were taking 8 milligrams lost 26.1% of their total body mass. But the best part, 60 to 80% of that was pure fat. So all the people who are saying that you're losing muscle on this medication, these people in this study were not doing any diet or lifestyle differentiation. They were just keeping with their normal program, and 60 to 80% of it was pure fat that they were losing. I don't care if you're dieting and losing weight on Jenny Craig or Weight Watchers, you're going to be losing fat and muscle. That's just how it works. That's what happens when we lose weight. But if we can preserve as much muscle as we possibly can by adding resistance training, which I have in here, but also having a medication that isn't going to muscle waste us on top of the person working with that plan, it's even better. So to be honest, I think this is landmark data. And like I said, it reduced fatty liver from 81 to 86% at a 48-week study. So just look for this retatrutide. It's coming in 2026. I wanted just to put the newest, latest, and greatest. I'm really glad it's being able to get studied. And
Yeah, and
be
before we
used.
move on from that, real
Sure.
quickly, touching on the muscle loss thing, because I think that's critical. A lot of people are wasting away. And some people will see like their loved ones or their friends, and they're like, oh my gosh, they're just like, they're
Yeah,
not looking healthy on this, tirzepatide or semaglutide or Ozempic, whatever. I truly believe that some people are overdosing and some people are not getting the support and the information that they need
correct.
from their doctors and providers to be straight with them that like this isn't a negotiable, this isn't an optional thing. You need to strength train and you need to get your protein in. A lot of
Yep.
people every single day I'm talking to women who are under eating and under eating protein for sure.
Yep.
And so you have to be on those supports. But if you have those supports in place and you're using your muscle, because think about it, this is a signaling molecule, it's a signaling thing. It's not actually you using your muscles, right? And so you still have to be active. You still have to engage and activate your muscles. But there's like I just see there's so many benefits for people who've been stuck in like the binging, the eating disorder, the food cravings constantly, the food noise, and it's so hard to get them to follow these healthy diets that I recommend. Like and we haven't even talked about microdosing, but like microdosing is the way to get some of these anti-inflammatory and appetite and food cravings under control without like the fast weight loss. Like we can do this really slow and gently. There's
Yep.
so many ways we can go about this that
And
work
this
for
should be
you and not
like you were
against
saying,
you.
this if these work better for people who are already, they've already dialed in, like they already are eating their proteins. They already know, they have like the base understanding, and now they're just using this as a tool to help.
Hmm.
Because if you are going to give a GLP, or anyone, a doctor, anything, they're prescribing. And I think the bad rap that these medications got a long time ago was because doctors were prescribing them for weight loss and giving absolutely no support. They're like, here's your script, and people were
Right.
and injecting them once a week. And they were upping the dose, cranking the dose, like you were saying. They weren't um
They were trying to just use it as like a quick fix
as a
and
quick
like
fix.
forcing the
Yeah.
body to
Hmm.
lose weight without actual health principles involved,
Yeah.
which
And then
is
they
kind of a
demonize the drug. And it's not the drug.
yes,
It's not the drug. It
exactly.
was the how people were using and misusing the drug, and it's how
Correct.
prescribers were misprescribing the drug. And so there's a proper way to do all this. And this is, I'm so glad this has come to light, recently, and people are getting more on board with there is a proper way to do it. And there is
Hmm.
you know, people like us and practitioners that want to help and partner instead of just giving it to them.
Yes.
So the next one is BPC 157 TB 500. Again, all of the words and all of the numbers. BPC 157 is probably the most well known besides GLP-1s. It stands for body protective compound. It's a 15 amino acid chain. It is synthetically derived, but it is made in our gastric juice, which is weird. And every time I say it, it sounds a little bit more disgusting. But it is something that is found naturally in our gastric juice. It's available in oral formulation, which is kind of exciting because it can be a supplement. Now, just so you know, the why we inject peptides, it's because, for instance, insulin is a peptide. It's also a hormone because it's 50 amino acids. We have to inject that. We can't take insulin orally because we can't absorb it orally. So it has to be a certain amount of amino acids to be able to be taken orally. And then we also have to wrap them in some sort of like sodium bicarbonate or something. So our gastric juices, our stomach juices don't break it down. So it makes it less bioavailable. When we're injecting something, we're surpassing that first past liver metabolism, we're surpassing our gut and all that kind of stuff, so it can get right into our bloodstream. But some of these can be taken orally. It just depends on the amount of amino acids and how they're made. Okay, so I also linked a couple of therapeutic applications of BPC 157, and there has been one human clinical trial to date, and it is linked in here as well. What BPC 157 is doing is it's stimulating something called angiogenesis. And angiogenesis is what Rebecca was saying when we're stimulating new vascular supply. So that's blood vessels and blood flow to an area for healing and regeneration. BPC 157 is really good locally. So you have a meniscus tear in your knee, you inject it near the knee. You have like other kind of people talk about the Achilles tendon because that's where it was most studied in mice, but you can inject it into injury sites and have some sort of rapid healing. There are some differences and efficacy differences, like I was kind of alluding to about the oral and the injectable formulations, which is pretty much what I just said for the bioavailability. But some people are really needle shy, which I was for sure. You get used to it, but you know, there are some oral formulations, and I wanted to note them here. There are some reputable companies. Again, these are available mostly through practitioners. So on platforms like FullScripts, where you're working with a practitioner or a practitioner has an account with a place that can get you the oral formulations. So they are more available because they are considered supplements or supplementation. So that's how they are available over the counter, kind of that way. Okay. And then TB 500, which they are separate things, but you see them formulated together a lot because they do work synergistically together. But TB 500 is a piece of thymosin beta 4. So it's 43 amino acid peptide, and it's a part of thymosin beta 4, which is a longer peptide. It's secreted again by that thymus gland, which is our immune system. It stimulates angiogenesis. So does BPC 157, and it upregulates a protein called actin, and that's going to promote restoration and maintenance of your cell structure, like the structure of the cell itself. So TB 500 has more systemic benefit, and BPC 157 has more local or acute, and so together they work really synergistically. So this is why we're talking about the dynamic duo here. If you're, they can be used, like I was saying, locally. BPC 157 is mostly known for gut, tendon, ligament, and TB 500 is more systemic, muscles, fascia, tendon, stuff like that. So again, they work really good for injury recovery, long-term tissue health, chronic inflammation, gut problems, things like that. There are multiple versions, injectable, oral combinations of them, but again, injectable is going to be the most absorbed. Okay. And then all of my beauties, because, you know, we're getting old here and we need to keep our skin aging gracefully. GHK-Cu.
Meet GHK-Cu, the skin and hair superstar. It is made up of.
That was from my course. It's recording. There it is. Okay.
Oh, wow.
All right. Could you guys hear that?
Yeah.
Oh my God. Sorry about that. So hold on, let me swap. Sorry, guys. My bad.
It's all good.
You're like, Laura, she's talking over her slide. All right. So I'm not even going to try to say this because I can't. The glycyl histol lysine, that big word. It's actually 3 amino acids. So it's actually a bioregulator, which we won't get into, but 3 amino acids. It's really small, but it's bound by a copper ion, and that's that copper piece. Okay. So it can be injected or it can be rubbed on the skin. So you're going to see a lot, like if we think of skin, we see sometimes in our skincare, like peptide infused and stuff like that. So this is just a specific peptide. And it also stimulates angiogenesis, like BPC 157 and TB 500. But it also helps to grow new tissue, Well, it removes the old. So it's kind of really cool in that facet, is it's going to get rid of old and regenerate the new. So it has some benefits.
I mentioned some of GHK-Cu's
Oh my God, I'm sorry, you
benefits.
guys. Some of the benefits are let me make sure I deleted all those. I did. So some of the benefits are going to be wound healing. So it also acts kind of like the BPC 157 TB 500. It's going to have some of that. Let me see. Can I do from current side? Sorry. So it's going to have some of those benefits as well. And it's also going to help with anti-inflammatory. It's also antioxidant. I will tell you this though, you guys, it hurts when you inject it. It kind of burns. So this one's a burny. It's a little spicy. But again, you can also rub it on your face. My husband also uses it for hair. So he had, you can get it in a serum and you can use it for hair regeneration as well. So that's really cool. I know a lot of people who like it for that. It also resets genes that are related to tissue repair and regeneration, and it suppresses cancer promoting genes. So talk about cancer in our FAQ. This one actually suppresses cancer promoting genes. So this one is really powerful. Again, there's lots of options. There's face cream, hair serum you can get from compounding pharmacies. There's liposomal oral formulations. There's different percentages that you'd want to do for all the different things. So obviously you want to work with somebody who knows what to use for the face, what to use for the body, hair, and injection for overall systemic. Okay, one of my faves, Tesamorelin. Before I go into what Tesamorelin is, I want to just talk a little bit about growth hormone secretagogues. They are compounds that stimulate the body's own production of growth hormone. So kind of what Rebecca was talking about in the beginning, where we're stimulating kind of our body to do something on its own instead of actually injecting growth hormone. So injecting growth hormone itself, like you would think of a bodybuilder, maybe back in the day, like injecting growth hormone, right? To get big muscles. That can burn out our own endogenous receptors for our body to not do that anymore. So it's not really a good idea to actually inject growth hormone. But if the growth hormone secretagogues just kind of tell the pituitary gland, hey, why don't you make some of your own growth hormone? So it's almost like a gentle reminder. Growth hormone is going to decline with age. Okay. Kids have a lot of it. That's why they sleep. Growth hormone is secreted mostly at night when we're sleeping. And it helps with muscles, fat metabolism, tissue repair. If you know kids, they heal pretty well. It boosts energy, recovery, sleep. It improves insulin sensitivity and body composition. So it is very amazing for anti-aging. And again, it's going to decline as we age. So like I was saying, on average, 14 to 15% per decade decline, you guys. So by the age 60, they're only, adults are producing only 25% of the growth hormone they did in their 20s. So something like Tesamorelin could be beneficial. It is an FDA-approved medication. So it was approved for HIV-infected adults with lipodystrophy, which is visceral fat around organs from their antiviral medication. So like I said, it is FDA approved. So it is something that you can get from compounding pharmacies with a prescription as well to be used off label. It binds to the receptors in the pituitary gland to tell your body to produce its own growth hormone. And it activates something called hormone sensitive lipase, which is going to accelerate breakdown of stored triglycerides and fats. Okay. And our last one, because I saved one of the best for last. No, I'm just kidding. PT141. This one is called bremelanotide. It is, again, another FDA-approved medication. But it is a synthetic peptide originated from, I can't ever say these words, melanotan, I can't say that, 2, which is actually in our brain, okay? And it's funny because it actually stimulates people to be tan. Isn't that weird? Like it's a brain chemical and it makes your skin become more tan. But there's a piece of it that's going to also help with libido. It's so weird. I don't know how tanning and libido work together, but it enhances, I know, isn't that funny? It
That is
enhances
funny.
sexual arousal in men and women. So this is really cool, you guys, because Viagra was the most marketed drug, right? But I'm telling you what, where are those men putting their very erect penises if a woman isn't also on board with this situation? So,
Amen,
you
sister.
know what I mean? So we have to,
I
and
mean, I I'm just saying we're kind of like not always, but like women, I feel like we are kind of like the gatekeepers to intimacy.
yeah,
Like we're kind of in the decider chair of like, is this gonna happen or not? Because like, am I even in the mood? And I think this is such a cool option because I know so many women now. Granted, we all work in like the hormone
yeah,
um, scene as well, and so we know how important hormones are to address, like you said in the
correct.
beginning, like all these different pieces need to be in place. And so sometimes women need like suppository support to make sure the
Yes,
tissue is healthy. And
yes,
like, obviously, we want women to be comfortable. Like, that's number one. You should be not be in
yes,
pain. There should not
yeah,
be any issue down there at all. Like we would want to address that first. But there's a lot of women that have been so burnt out from literally decades of being putting themselves last, so to speak. And so at that point, you're just burnt out and like your hormones are lowering, your peptides are lowering, your brain is not getting these signals to like, well, hey, let's make a baby. And on top of that, when you're in that midlife stage, you're not ovulating as much as you were before. Like you don't get those signals to be in the mood, and it can affect your relationship. It can affect like, a lot of women want that part of themselves back. And they're
yeah.
like, I miss
I've
feeling
had,
that way. I miss wanting that intimacy with my partner. I just don't feel it. And so what's really cool about this, because I know there's like other, I guess, prescription options and stuff, but all of those are having to do with blood flow
yeah, and
and
this
more
one
of a
is not.
physical aspect. What really makes this one unique and really perked my ears
Mm-hmm.
for some of my clients that are struggling is because it's literally like the brain
It's the brain.
signal is coming back on board. So it's not your body becoming aroused and you mentally not being there. Like,
Right.
how weird is that, honestly,
Yeah.
to be like physically engaged, but like still mentally, you're like, I don't mentally feel it, you know?
Mm-hmm.
So what's cool about this is that it's actually working on your brain receptors to that
Correct.
stimulate that area that would make you interested genuinely. And like, how cool is that for your relationship and, for you to like kind of reconnect and everything. So I think it's a really, really cool tool.
And like you were saying, it's effective for treating this. And this is another thing. There's not very many sexual medicines that are medications that are approved for both men and women. This can be used in both men and women. So we have like Viagra and Cialis and all of that, which increases blood flow. And that's going to be for erectile dysfunction and stuff, but it's like, well, what about the women? Well, like I
Hmm.
said, this is female sexual interest or arousal disorder. That is something real. It is a prescription medication, but it is also something you can get as a peptide. And it enhances libido and it's non-hormonal. So if you are doing hormone replacement therapy and you're not getting to where you want to be, this can be a great alternative and option. It's something that's inject 30 to 45 minutes prior to intercourse or sexual intimacy, and you just see how it goes. So it's something that can be added to your arsenal in our midlife.
And there are other delivery methods for that one too, where there's like a
Nasal spray.
melting one under the tongue and then or dissolvable, and then there's one that's like a nasal
Yep.
spray. So there's other ways to get it, but I have heard just from different, feedback. I believe the injection, like Laura said, most times that's just better absorbed. But everybody can kind of try their route that they want to try first and
Yeah.
see how it
And
goes.
like you were saying, with peptides, there's a multitude of delivery mechanisms. There's intranasal sprays for some. There's going to be an intramuscular, which is something that is in the middle there, and then what we call a subcutaneous injection. So that's there with the little insulin needle. There's also Now there's some strips that you can get. There's the, obviously, like I was telling you, there's liposomal, there's supplements that some of them that can be taken. There's some that are now even eye drops. So there's all these delivery mechanisms I'm sure are going to be exploding on the scene. And but for the most part, when we're talking about injections, this is where it comes into play, where we want to really talk to someone who knows what they're talking about. Okay, these are insulin syringes, all have different units of measurement, but they're all different in the amount that they're holding. So the milliliters, is not the same as your dosage or your milligrams, and people get this messed up. And I've seen people overdose, and I've seen people really screw up their dosing. So understanding this, partnering with someone who understands this is super important. There's all of these 30, 50, 100 unit syringes that you can get them in, and it can be very confusing when you're trying to dose. Okay. I'm just going to give one example here. This is just just an example to show you how exactly confusing it can be. So Zepbound, which is the brand name for tirzepatide, there's 2 vials here. One is 2.5 milligrams per half a milliliter, which is the concentration of the medication. So 2.5 milligrams per half of milliliter. 100 units is 1 milliliter. So if it's 2.5 milligrams per half of milliliter, that means it's 2.5 grams of medication for 50 units. Okay. But then if you went up to the 5 milligram per half a milliliter, 50 units is then going to equal 5 milligrams, not 2.5 milligrams, because the concentration of the medication is different. So there are some calculations that would need to be done, and every compounding pharmacy and everyone, they have all different kinds of 2.5 milligrams per 1 ml or half ml or 5 milligram or 10 milligram. So you really need to make sure you're looking at the bottle and you're finding someone who knows how to dose it appropriately with you.
So on that note, is this the correct like understanding of what you're saying where let's say for instance like a scenario where there's 2 girlfriends who are both on peptides,
Yeah.
maybe different blends, whatever, and they're getting from different, they're getting from their own pharmacy, whatever. And so they're like, "Oh, how many units are you taking?" "Oh,
Yeah.
I'm taking
Yeah.
this much and
Yeah.
this is working better for me." And
Yeah.
so it's like we definitely have to be careful about
Yes.
not taking advice from your girlfriend or, someone
Yeah.
who is not actually trained specifically on peptides and dosing and all of this because yeah, this is where like I start to get a little protective for my clients and for my audience and my community like, hey guys, like let's not do this willy-nilly and like
No.
DIY and like all this
No.
starts to get a little sketchy to me because these are important signaling tools and we don't want to do it in a way that's harmful to us in any way. So just
And also, like I
just
was
wanted to
saying,
clarify that because people are like, what does that mean about
yeah, what
units?
does that mean?
But
Yes.
when you start getting into peptides, people start talking about they're on this many units. I hear this and I'm like,
Yeah.
guys, like stop talking about units with each other like you're gonna get advice from each other. Like that's not how this
Yeah,
works.
because like I was saying, even semaglutide, tirzepatide, retatrutide, those are all GLPs. They all are very wildly
Very
different.
different.
And like you couldn't say, oh, I'm taking this many units in semaglutide, and oh, well, what am I taking in tirzepatide? That should be the same. Absolutely not. It's so wildly
Hmm.
different.
Yeah.
So to be very careful with that. Also, if you've heard of reconstitution, this is just something I want to throw out there. Reconstitution is when the product is not coming from a already like a compounding pharmacy that is mixing it and making it ready to go for you and delivering you a full product. Reconstitution is when you're getting a lipolyzed, it's almost like freeze dried of the peptide itself, and you have to actually add the water for the peptide to dissolve into and draw it up yourself and do all of that. This is even a little bit more nuanced because of how much water you add discerns what the dosing is and the concentration and all the different things. So again, I just wanted to put the word out there because I know people might have heard it before, like you were saying, units and measure and all of that. Like reconstitution is something, if you were to buy it from a place online, that it's not a compounding pharmacy that is licensed and that you're just buying it from somewhere online and you're having to do the mixing yourself. Okay.
Yeah. my 2 cents on that is no, thank you.
Yeah.
That's just me, but
Yeah, I know. Sourcing. So, like what you were saying, where can we get these and where's a good source? So, first and foremost, we can get them through a prescription. So, there are FDA approved peptides. Tesamorelin is one, tirzepatide is one, semaglutide is another. You know, there's like PT 141 is also a one that is I think it's called Vyleesi. It's a FDA approved medication. So there is that. There's also compounding pharmacies, and there's two different kinds of compounding pharmacies. There's a 503A compounding pharmacy and a 503B compounding pharmacy. They have different regulations and they have different standards, but they are prescription only. So you'd have to get them from a licensed prescription provider, and they do come already mixed. And then there's also research chemical companies. And these are the ones that you're going to see online that say not for human consumption, for lab use only, which they mean, hey, these aren't sterile or approved for humans. We just know that you can use them in your own basement laboratory on a mouse if you want. Okay. So that's what those mean. And then there's also these labs that are popping up that are making like the lipolyzed peptides, and you can buy them offline. And then there's also the online supplement stores and things like that that you get them through or through practitioners. Okay. There's also, so definitely we're not going to try to get these off the black market or anything like that. You're going to want to talk to people like us. So me, Rebecca, and Ashley, who know where to get them and what are good and what are not good. So you're not just injecting random things into your body, because that's never a good idea. So things that you should look for, though, for sure, is a certificate of analysis, third-party testing, and transparency. If you are going with a provider and you ask them, if I'm talking to a practitioner or a client right now, and you're like, where are they sourced? Who makes them? What's the company? Are they 503, you know, are they legal script certified? Are they 503A? Are they 503B? And they can't answer that question, I would not be going with them. Right?
Mhm.
Like if they're not giving you a straight answer of where they're made or where they come from or what they are, then I would not be injecting them into my body, just like I wouldn't be taking that medication or that supplement either if you can't tell me where it's sourced from. And this is just a little bit about me. This is I have my own practice similar to Rebecca and Ashley. I'm an FDN as well, so we're in the same kind of family. I do I do peptide consults for practitioners. So if there's people who want to start learning about peptides as a practitioner, I have published a course about peptides, and I can counsel on protocols and stuff like that. And I also have my own client base here in Michigan, and I really appreciate you guys having me today.
Aw, thank you
For
so much,
peptides.
Laura. You're such a wealth of knowledge, and um I did get started through your peptide course because I was just like, I love what you're
I thought you
doing.
might
I
have, because
wanted to
what you were
support
saying
your
today, I was like,
journey, yeah, with the
yeah.
course. And I was like, you know what? I even have some like practitioner friends in my group, so I think they'll be interested as well. But yeah, your course has been really, really helpful and insightful. And I know even just this short live, less than an hour, I feel like people have learned a lot of really, really good, valuable information from this. So yeah, thank you so much for your
Yeah.
time. It's
Yeah,
awesome.
no problem. I actually do have a hard stop, you guys, but I really appreciate you guys having me.
Thank
And
you.
I hope it gave everyone a wealth of knowledge on peptides.
Absolutely, for sure.
Yeah.
Awesome. Well, thank you guys. Take care.
Thank you.
Bye.